Hello, everyone, and welcome to today's webinar on unlocking your rural health care excellence with the Texas A&M Health Rural Engagement Program. My name is Cassidy Avila, and I'm the program coordinator for the Rural Engagement Program, and I'm joined by multiple speakers today whom I will introduce throughout the webinar as we present an overview of the program for you. This unique program is comprised of three components: rural medicine, rural nursing, and technical assistance. There we go. And as you see here on the agenda, we will be going over all of those components. Just a quick note, there is a QR code for contacting us on the final slide as well as a website. But do feel free to message me throughout the presentation if you wish to engage in any of these components, and I'm happy to share a direct contact or the chat with you. There will be time for Q&A before we adjourn, and you're welcome to drop questions into the chat during the presentation, and I'm happy to pose them to the speakers following the webinar, or you may unmute and ask questions during that time. We are recording the webinar, and we will make a copy available to you soon, as well as some resources and a follow-up email. So it is now my pleasure to introduce our first speaker, Dr. Kia Parsi. Dr. Parsi is Executive Director of the Texas A&M Rural and Community Health Institute and Executive Director of the School of Medicine Rural Program. It's all yours, Dr. Parsi.
Well, I appreciate that introduction, Cassidy. I want to start by saying thank you to all of you that are working in rural communities in Texas for healthcare. Thank you for the work that you do. For the over 2 decades that I've worked as a rural physician in healthcare, I know your job is not always easy, but it can be highly rewarding. And those of us that are working in healthcare are doing it for the right reasons. So thank you for all that you do. Cassidy, we can go to the next slide. And that's why I'm so excited to present to you all the Texas A&M Health Rural Engagement Program. This program is a partnership between the School of Medicine, School of Nursing, and the Texas A&M Health Rural and Community Health Institute, and it is funded by the Texas Legislature. So these initiatives that all three institutions are providing as part of this program will mostly be free of charge. Next slide. So the purpose of the program is to support rural health care in the communities that you serve, either in the clinic or hospital setting. And we're going to do that in two main ways. First of which is through workforce. How can we encourage the Texas A&M medical students and nursing students and other students to consider rural when they finish their education for a future career? The second way we're going to help our rural communities is through operational support. How can we provide technical assistance to improve your operations, your financial performance, so you can maintain viability and provide health care for your communities? So our goal is to broaden access and fortify healthcare delivery for rural Texans. We are a group of physicians, nurses, nurse practitioners, and other experts that have experience in rural healthcare. And our goal is to serve you in your initiatives to provide healthcare, high quality healthcare for the communities that you serve. Next slide. As mentioned, we have three institutions in this rural engagement program: School of Medicine, School of Nursing, and the Rural and Community Health Institute. Each of these three have different initiatives. And in the next 40 minutes or so, you're going to hear from representatives from each of these institutions about the programs and initiatives that they are doing. If you have interest in these programs and you feel like they would be useful for your organization, as Cassidy mentioned, at the end of our presentation, there will be a code and a link where you can reach out to those leaders in each of these institutions and learn more about their programs and possibly utilize their programs in your community. Next slide. And I want to start by talking about telehealth. Texas A&M Health Science Center has a telehealth institute recently formed. And the Telehealth Institute does have three components in this rural engagement program. The first of which is actual consultations, telehealth consultations, and the initial focus will be on behavioral health. The reason is behavioral health is high need in our rural communities, and behavioral health is ideally suited for the telehealth environment to be able to provide consultations effectively. So our Telehealth Institute has the capability to provide these behavioral health consultations through psychologists, in the future, psychiatric nurse practitioners, and possibly psychiatrists to actually provide these consults for your communities that you're serving. The second way is through education. Under telehealth echo sessions, these same experts will have monthly case studies that they can go over with your practice. So your local practitioners can learn how to care for these patients and not need consults with every visit of every encounter for patients with behavioral health. Our goal is to extend past behavioral health into other specialties as well. And the third way that we want to integrate telehealth with the rural engagement program is through our curriculum and instruction for our students. So our nursing students and medical students understand how to use behavioral health, telehealth, and other specialty telehealth capabilities most effectively in our rural communities. So as mentioned at the end of our presentation, if you have interest in linking up with our telehealth capabilities, there will be a Zoom link and a barcode for you to find out more information. So Cassidy, next, I would like to turn it over to you to introduce our next speaker on our School of Medicine program.
Yeah, so I will just take a moment to introduce the School of Medicine team. Curtis Donaldson is Director of Rural Medicine Outreach in the School of Medicine and Director of Community Engagement Rural Texas in the Texas A&M University Office of the President. Also, Cassie Shelton is the Director of Operations for Rural Medicine. And speaking today on behalf of the School of Medicine is Carol Brewer. She is the Assistant Director for Rural School District Relations at the School of Medicine. So Carol, you have the floor.
Thank you so much for having me today. I'm excited about this opportunity to speak and talk about our program. The Rural Medicine Program is looking to address the shortage of healthcare professionals in underserved rural communities in Texas. And we do that with a three-part approach. The first being that we are taking our medical students into rural clinics and hospitals, and they're working side by side with rural physicians in rural Texas. And so our medical students are rotating in that clinical experience. The second part of that is that our students are then immersed into the community in which they are rotating. We bring together a group of community members and leaders and talk to them about the importance of healthcare in their community. And this is a way for them to, it's really economic development for them. It's a way for them to promote their community and support that rural engagement and the practitioner that we're sending to them. And so this has been very vital in our program in that our medical students get so much from being immersed in the community and understanding that as they practice, as they grow and go to practice medicine in rural Texas, that they really are a leader in the community and can very easily be immersed and adapted to that community. So that has worked really well for both the community and for our medical students. And the third part of our program is exploring health careers in local high schools and supporting rural Texas high schools to grow our own. So the student that is going to practice rural medicine is more than likely from a rural community. It's a rural kid. And so we want to go into those rural Texas schools and offer some support to them to programming that they may already have or programming that they're looking to grow into. And this happens in a multiple ways and is growing every day. But we want to cover both the long term and the short term in allowing our medical students to practice in rural Texas and rotate through rural Texas clinics and meet those practitioners, and then also provide some support to those local school districts so that we're growing the next generation of medical students. Then in addition, we have a community app bar project, and this is a project which allows critical access hospitals to identify and prioritize factors that are important to retaining family medicine physicians. Cassidy, can you go to the next slide, please? So this project will support critical access hospitals. It will give them data and guide them in strategic planning. And if there are any questions or information that you need, you can just email that email there listed. Can I have the next slide? The last thing that we'd like to tell you about from the Rural Medicine Program is that we are having our first Rural Practitioner Conference in Texas. This will be held in March in Fredericksburg, Texas, which is a perfect place to bring together practitioners for rural Texas medicine. And so it is open to everyone. And if you are interested in registering, please use the QR code to find out more information.
Excellent.
Thank you, Cassidy.
Thank you, Carol. Let's move on to the School of Nursing. And so our next speaker is Dr. Sharon Dormeyer. Dr. Dormeyer is a professor and associate dean for undergraduate nursing education at Texas A&M University School of Nursing. And accompanying her is Dr. Nicole Kroll, associate dean for clinical and outreach affairs and clinical associate professor in the Texas A&M University School of Nursing. And she's leading the nurse-led care delivery component of the program. So Dr. Dormeyer, it's all yours.
I could talk all I want. If I'm muted, it doesn't work. So I apologize. Thank you so much for that kind introduction. For the School of Nursing, we know that the education level of nurses in practice is related to patient outcomes. There's a substantial body of evidence in support of that. So toward that end, one of the main focuses for us is in advancing the education of nurses currently practicing in and living in rural settings. So let me repeat that. We're really trying to advance the education of the nurses who are already there practicing in rural settings. And so what you see on this slide is one of our big initiatives is having scholarships available to support nurses who want to come back and up their education or advance their education level. So RN to BSN scholarships, master's scholarships, family nurse practitioner, DNP. We're providing scholarships that really almost ends up being a free ride for the student the whole way through the program. In addition, our other initiatives, next page, please, or next slide, is to develop a cadre of practitioners, nurses, who want to and who embrace rural nursing and are totally enmeshed with it. And so we have, what I'm very excited about is a curriculum revision that we're doing where we will be having students in rural settings, in communities in the Brazos Valley every semester. They'll work, hopefully, ideally, they'll work with a community the whole way through their program so that they have really understanding of what it takes to be effective. And as other people have alluded to in the presentation, it takes presence. It takes being accepted as part of the community. And so we want them to learn those skills and learn the needs and learn how to do with people, not do to people. And then the final piece, which if Dr. Kroll is on, I'm not sure she is, but if she's here, she could speak more too, and that is some nurse-led care delivery. And toward that effort, we have some nurse-led clinics, like in Navasota, very successful clinic, and we have some vans, Texan mobile vans, where we're out providing care. There's 2 exam rooms in the vans. They're pretty exciting to see, and students do participate in each of those as well. So we have lots of ways that we're exposing students to rural nursing, rural healthcare, and hopefully building a pipeline of people who want to work in rural settings. So that's it. Dr. Kroll, are you on?
I did not see her. Okay.
Okay. So thank you. That's our stuff. And if you want to talk about any of those things, I'd be glad to talk with you.
Thank you. That was excellent. So I'm going to take a moment to talk to you about the technical assistance piece from Archie, or the A&M Rural and Community Health Institute. So participating organizations through technical assistance are supported with a dedicated one-on-one regional technical assistance coordinator, along with virtual and on-site facilitation. So through that comprehensive needs analysis that's conducted at the beginning of the work together, the healthcare organization works with the technical assistance coordinator to formulate and implement an action plan. There's also the potential for more limited scope technical assistance if there's something specific an organization requires support for. So I'm just going to move down this slide and talk about the types of support available, starting with financial performance. And so depending on that needs analysis, this could potentially include a cost report review, revenue cycle analysis, or productivity benchmarking analysis. And we collaborate with healthcare financial experts to provide these services. Our next slide goes into detail on value-based care payment models. So I'm going to wait and let Rayanne talk to that piece. And you just heard a bit about workforce development opportunities with the School of Medicine and Dr. Dormeyer's previous slide on the School of Nursing, clinic practice opportunities and educational opportunities. So I'm going to move on to service line development. We have a couple of opportunities here. We are able to, in some cases, share a service line profitability assessment, which helps identify whether a service line is performing at its highest level and also help hospital leadership understand which service lines hold the greatest opportunity for growth. We also have a swing bed development or maximization program where an organization works on-site or virtually with a consultant on staff and physician education, external and internal referral development, and then implementing consistent processes in their swing bed program. We also support a project around predictive modeling for long-range financial planning on what various scenarios may look like to support service line implementation. Next bullet in marketing and community engagement. So this includes marketing approaches to service line campaign development as well as patient out-migration and could include other things as well. We also host monthly educational webinars on rural healthcare topics. So everyone registered for this webinar will receive updates and registration links for those webinars. If you wish to be added to the listserv, please do reach out and we'll make sure that we get you on that list to receive those updates. And I just want to reiterate something that Dr. Parsi said about the fact that there's no cost to the majority, if not all, of what you're hearing about today and your ability to participate in any of the program components. So please do reach out at the end of this presentation if you want to hear more about the technical assistance that we're able to provide. So I'm going to introduce Rayanne Davis now, who is the Director of Value-Based Care at Texas A&M Rural and Community Health Institute, to tell you a little bit about value-based care. Rayanne?
As mentioned prior, the Rural Engagement Program supports healthcare facilities and clinics in their efforts to provide high-quality care. Aligning with these goals, we are offering value-based care technical assistance with a focus on 4 pillars of support. This engagement will help optimize and enhance the value-based care contractual incentives across various payers. The consultative engagement is tailored to the organization's needs. One of the challenges providers often face is that value-based care incentives and metrics differ across payers. So via this engagement and support, we can assist by conducting a contract inventory, creating a payer matrix, detailing the existing contractual terms and characteristics. The matrix helps quantify the financial opportunity of the incentives, comparing to the current value you're getting out of your contracts versus what the full financial potential would be in these value-based care incentives. It also provides a crosswalk of performance metrics across various payers and ultimately delivers a tool that will assist in prioritizing initiatives and efficiencies, enhancing financial income. The technical assistant also helps examine current value-based care performance, creating actionable recommendations and best practices to improve performance. We are here to help provide support in strategic planning, evaluating new opportunities to pursue growth in value-based care and identify alternative payment models that reward our small town healthcare providers for their high quality care. In addition, the remaining 3 bullets, we are creating programs supporting providers in quality performance and care gap closure. Also looking to help support and create a program in enhancing capture of the accurate diagnosis codes to improve HCC risk scores. And then offering virtual care management teams that can assist with chronic care management, remote patient monitoring, and transitional care management. We recognize that these activities are important to the success in value-based care, alternative payment models, and they provide opportunities for additional financial incentives. If you will go to the next slide, that would be great. For technical assistance, the process that all the opportunities announced today in this webinar, if you are interested, would like to learn more, or want to go ahead and take advantage of these opportunities, complete this inquiry form. You'll see the QR code there, and we'll paste the link in the chat where you can access it. It's a quick inquiry form, just a couple questions. After you complete that form, we'll set up an initial call with the program coordinator to learn more about what your priorities are and what you're interested in. We'll do further team interviews to identify the priorities and scope of the opportunity, and then follow by on-site and virtual planning sessions. So what are going to be the deliverables? How will we implement the technical assistance? And then as we go throughout the planning process, we'll do an assessment and data collection and implement the projects and support opportunities. We'll have ongoing plan review to make sure that we're meeting those deliverables. And lastly, we want to make sure that we are implementing these programs so that they're sustainable for our rural providers and in a way that we can evaluate the program success so that we can share these great success stories of our rural providers. The last slide really goes into questions. Q&A, Cassie's going to take that over. But before we do that, we also have a website dedicated to the Rural Engagement Program. The QR code is here. You can access that website. It provides additional details about the program as well as our contact information. So if you'd like to outreach to us directly, feel free to outreach to us directly. So thank you so very much for attending our webinar, and I'm going to turn it over to Cassidy for a Q&A.
Great, thanks, Rayanne. So as Rayanne said, we've arrived at the Q&A portion of the webinar. You have the option, you should be able to unmute yourself. And if not, please just click the little button to raise your hand and I'm happy to unmute you. Or you can drop questions into the chat. You can address those to everyone or you can address them to me. I'm happy to ask the question on your behalf. Just select my name, Cassidy Avila, and I will make sure we get your question out. I did drop that inquiry form link into the chat, and Rayanne just dropped the link you see on your screen right now for the program website, so you can easily access those. I'm going to look through chat and see if we've got anything. Not yet. So let's see. I don't see any hands raised. I'll give you a moment to kind of draft your questions and drop them into the chat. But if I may, you will receive an email following this webinar within about 24 hours. In that, you will have a link to the copy of the slides, as well as kind of an overview 2-page document that gives some really concise details about the program. And then all of our contact information just for your convenience. So you can be expecting that in your inbox soon. I don't see any questions. You must have covered everything. We still have plenty of time if there are questions. Any final thoughts from anyone? Any of the speakers today? I think everyone did an excellent job presenting the material, and we really appreciate your time.
Hey, Cassie, this is John Henderson. I have a few questions. Appreciate all that you're doing, especially the way you're trying to cover the cost. With regard to the physician program, and I've heard great things about it, have you also had physicians who go through that immersion experience and say, wow, that's not what I thought it was going to be, or that's not for me, or has it been 100%, uptake to the rural community hospital? Because I could see that it would kind of cut both ways.
John, this is Kia. I'll answer that. Who would not want to work in rural Texas? Right? I will tell you, all of the students that have experience, and again, this is a program that we've really had a good number of students this last year. It's an elective. So the students that are doing this elective have some kind of interest. But I will tell you, we've had some students that would not have considered rural before this rotation and now are considering it after the rotation.
That's awesome.
I'll give you one example. Yeah, there's a student, he's from Sugar Land. That's a suburb of Houston. Never been in a rural area. He thought it might be neat to check this elective out. He did the elective. He texted on his way back, driving out of that community. And his text was, I could see myself living in this community. So, awesome. Yeah. Now, we're going to make this, our dean, Amy Ware, has said that she would like this to become a mandatory, at least 2-week elective. Not everybody is going to want to be rural, although I don't know why. But many of the specialties will be urban specialties in healthcare. Okay. It's good for them. Yeah, it's good for them to have that experience, though. It's good for them to know a neurosurgeon in Dallas that gets a referral from an ER in a rural community. It's nice for that surgeon to have had some experience in a similar rural community to know what they're experiencing.
Yeah. I appreciate that. With regard to the telemedicine offerings, is that, I know that to some extent Texas is so big that we get regionalized. Will those services be available to all of rural Texas, regardless of geography, or are you focusing on the Brazos Valley or a particular region?
Right. Well, we're starting out with behavioral health in certain select communities that we're developing other relationships with, and it is outpatient. So there's a need also for ER, for emergent behavioral health needs. This is more outpatient relationship with the clinic for outpatient consults for behavioral health. Part of this is actually with the school districts, working in providing referrals for students that have behavioral health issues. We don't have the capacity to cover the entire state, but we have already reached out to a handful and have started this behavioral health consults.
Yeah, okay, thank you. Last question for me, and I was a little bit distracted, I apologize, but I think I heard someone make reference to a listserv and let people know if you want to be on that. Who do I aim that at, or how do I enroll?
I will take care of that, John.
Thank you.
And we just had a please go ahead.
Before we finish, I want to acknowledge Torch does an incredible job for our rural hospitals, and this engagement, as well as all the other state programs, we have to work with Torch and support all that you're doing, John, and the great work that you're doing.
I appreciate that, Dr. Parsi, but one thing I know for sure is we've never done anything with a lot of help and good partnerships and people like y'all. So back at you.
Okay, sounds good. Thank you.
And we did have a question in the chat, but I think Carol is covering it. So the question was, we'd be eager to host medical students or residents in the Hill Country. How do we engage in the program? And Carol, I see that you're trying to find out where that individual is. And so I will make sure that I make a connection between you guys offline as well. Let's see, we have a couple of other comments. Okay, just a direct message to be added to the listserv. Yeah, I'll take care of that, no problem. Any other questions?
Cassidy, this is Cassie. I would just like to add something if that's okay.
Absolutely.
I apologize. I'm in the parking lot of Baylor Scott and White. I'm about to go in and get an MRI, so that's why you can't see my face, just this map of Texas. But I wanted to add on to John, one thing we do whenever we set up our preceptor rotations in the rural communities is that Dr. Parsi right now is literally, he contacts each physician that may be interested and has a one-on-one talk with them. I really feel like, because most of us are from healthcare backgrounds, myself being a registered nurse, obviously Dr. Parsi is a family medicine physician. The last thing we want to do is put a burden on the practitioners. That is the very last thing we want to do. So we make sure that we don't rotate students too frequently in the same community so they're not overwhelmed. And we send out that the monthly newsletter so that we can show the community and the physicians the impact they had on the students. And we offer them little perks like coming to that rural conference that we're having free of charge to include hotel costs for 2 nights. So I think as long as we stay focused on keeping the practitioners happy, our students will be happy, you know?
That's like 90% of healthcare.
It's not easy. It takes a whole team, but the physicians in rural Texas are our favorite people. I'm surprised at how willing they've been to precept. And so we just want to, protect their time as much as possible. That's the most important thing, really, because we want our students to go work with them.
I hear you. I expect there's recognition that they need help, so they want to be part of the solution, you know?
Oh yeah, we have physicians that want to retire, and
so that's a motivator.
Yeah, they're committed to their community, but they need someone to replace them. I will just add to what Cassie said about this program. Yes, we've had great physicians and advanced practitioners in these rural communities that are supporting this program for the School of Medicine initiative. Another component, and this was but really engaging the community and giving the community the opportunity to really put a limelight what is available in their community for these students, and letting these students get immersed into local activities. From the student perspective, they can do clinical rotations anywhere, but having this community immersion piece is impactful for the students.
I will add to that. I don't tell the story as well as Curtis Donaldson does, but he talks about student rotations and how the different counties and communities are vying for the students' attention. And one particular student that was able to ride in a helicopter, and that community thinks that for sure she's going to come back and sign a contract with them. And then another community calls Curtis and said, well, she had this great experience in our community, so we're sure she's going to come back to us. So we have had a lot of success with our students and their rural rotations, including one student that has already signed a contract to come back to Mason County. So when he finishes his residency, he will return and be their next local physician. So it has been a real good experience for both the communities, the practitioners, and our medical students.
Awesome. I've never been recruited. I've never had that experience. Hey, last question, then I'll shut up. I'm sorry to talk so much, and this may be aimed at Sharon. I love what y'all are doing with the way you're reaching back into the high schools and with that homegrown program. And we found not only can you make a significant impact on that person's career path, but those are also the people that stay, because they love the community and know what they're getting into and have roots in the community. How do we, if we know people like that, I assume that this website will be where you put that information and applications, or is there a better way to access it?
So currently, once we get into the community and bring that community stakeholder group together, that is really a boots on the ground kind of thing that Curtis and myself go into the communities, and I'm meeting face to face with all of the superintendents in the county and offering them those services that we have. And really, because we're brand new in the ISD aspect of this, I'm really doing a one-on-one interview of the school district and finding out what their local needs are. Each one is very unique. I come from a unique perspective. I have a background in healthcare. I was a nurse for 20 years and a health science teacher. I've been an administrator in a school district. So I'm able to speak with them and kind of see what their needs are and then build a program around that. Currently, we're offering programming. Currently, we're offering programming in multiple aspects in that we're doing career exploration activities K through 12. We are looking to build a program where we offer teacher and counselor support and then offer that scholar support. So for that one little Joey that really wants to be a medical practitioner and is in a small town school district, how do we get him from where he's at to where he needs to be in order to get into undergrad and then medical school?
That's an even better approach than I thought of, because it's that local leadership or faculty that can tell you, 2 or 3 kids that are really smart but don't see college in their future.
Right. And we are meeting those needs or looking to meet those needs of each school district individually based on what they need.
Thank you. Thank y'all.
Thank you.
Thank you, John. Any other questions? Okay, I don't have anything in the chat. Thought I heard someone. Okay. Well, unless there are any final comments from any of our speakers, then I will go ahead and close this out. So be looking for that email in your inbox to follow up with this presentation. And I just want to give a huge thank you to everyone in attendance for your time, and especially our speakers who shared all of this information. It was a pleasure being with you today, and I hope that you feel inspired to reach out and contact us and learn more about the program. So I will let you go. Give it back a little bit of time today. Thanks, everyone. Bye.
Thank you.
Thank you.